can dental implants be placed in just 2 millimeters of a bone? In this case I've done exactly that. Here we can see a ridge where there is just 2 millimeters of a bone. I used a special technique called bone manipulation technique. Here is a patient photo just before the treatment and her lower jaw just before the treatment. In this picture we can see her 4 lower incisal teeth that are widely apart and slightly mobile, and she had significant gaps in the front of both arches, top and bottom jaw. Following a detailed planning of this case and patient agreeing after presenting her with digital visual model of her final smile on 2 implants and a bridge, I used a special technique and special instruments to do this procedure, and I used combination of piezosurgery for ridge splitting, then Tatum bone expanders we can see here to widen the ridge. This is a lovely piezo, and after this is like a splitted ridge, and we used also Osstem ESSET kit, which you can see here, to precisely expand the bony housing for placing 2 3.5 dental implants by Osstem in bony envelope. So this is the implant we placed. So we basically gradually widened the ridge, first by piezo, then Tatum and expanders and Osstem kit to be able to place implants in between. At the end we added a little bone graft and sutured everything precisely and carefully for optimal healing. Here you can see a post-op of Osstem integrated 2 implants, and this is just amazing section of a CT scan where we can see that I created from 2 8 millimeters of a bone. This is a lower jaw healed and implants are underneath the gum Osstem integrated, and the healing screw placed in, and this is her bridge on model. She agreed on to 6 lower incisal teeth instead of 4 for aesthetics and function. This is a CT scan, again pre-op photo, and a beautiful smile after. Predictable outcome with fewer interventions.